Good morning, all. Good morning. You're welcome to our today's class. We are still on the course AUM 221, Action and Uses of Medicines 2. So today we go over to a new topic. And the topic for today is classification of drugs and drugs used in an alimentary system. Drug used in the disease of alimentary system. So we just look at the drugs for this system, then classification of drugs in general. Okay, actually, there is no single universal way of classifying drugs that suits every discipline. So it depends. So the method of classification that can be used depends on the professional perspective. It also depends on whether what I mean by professional perspective is whether the profession is clinicians, pharmacologists, or medicinal chemists. In fact, if you go to medicinal chemistry, drug classification is different. It has a lot to do with the functional group and the structure and what have you. If you come to pharmacology, how the classification is somewhat different from what you see in medicinal chemistry. So there's no universal way of classifying drug, but for the purpose of what we are doing, we can look at drug in two ways, from two perspectives, based on the therapeutic use and or the action on the body systems. So you see things like anti-malarials, anti-diabetic drugs, anti-hypertensive drug, analgesics. So from the name, you know exactly what this drug, what they do. Like anti-malaria, you know that here, this one is opposite, they attack malaria. So anti-diabetics, they fight diabetes. Anti-hypertensive, hypertension. So from the name, you can know, this is based on their what? Therapeutic what? Therapeutic use. Therapeutic what? Use. Based on their what? Therapeutic use. Okay. Now, we can also look at drug from the perspective of their mode of action or the site of their action. Mode of their action and site of their action. You see things like the drugs that exhibit molecular interaction. They interact with specific molecules in the body. Things like receptor blockers. There are drugs that are antihypertensive. They also attack and interact with some receptors in the system, like beta blockers. There are some drugs that are used to treat one or two things in terms of maybe some drug used in treatment of prostate, BPH, benign prostatic hyperplasia. You see things like alpha blockers. You know, all these things, this one, they interact with specific molecules. There are also some classes of drugs that also, their own is to inhibit enzymes. We made mention of ACEIs, angiotensin converted enzyme inhibitors. It's an example of drug that inhibit enzymes. As you can see now, angiotensin converted enzyme inhibitors are antihypertensive, but they are enzyme inhibitors. Now, what is it called again? Beta blockers, antihypertensive, but they are what? They are what? They are enzyme, what is it called? They interact with receptor, calcium channel blockers. So all these things are different classes of drugs. We also have the ones that are that focus on cellular sites, like loop diuretics. They just go to the loop and exert their function. They are not attacking any enzyme there. They are not working on any receptor. They are just there at the site, loop, loop of L. So these things, this one interact with the cellular site. And also do that focus on physiological system. They keep adjusting some physiological system, increase this side will go down. They will cause vasodilation so that the blood will flow, BP will come down. These ones are under physiological system manipulators. Let me use the word manipulators. Something like vasodilators, vasoconstrictors, anticoagulants. They cause anticoagulant prevent coagulation. So these things are I just mentioned now. I've just brief overview of what classification of drugs look like. What classification of drug look like. Hope you can still hear me. Hope you can still hear me. Please, someone should speak to me.
Yes, sir.
Good. Good. So now let us just look at the classification based on therapeutic use is more general. It's general and it's more comprehensive. So I'll focus my attention on classification based on the therapeutic use or the action on the body system. So based on that now, we will base this discussion based on the essential drug, World Health Organization essential drug list classification. So that's what we are going to focus on. But before I'll do that, I want to let us know, well, I want to say one or two things about essential drug, the concept of essential drug by the WHO. What are essential drugs? Essential drugs are those drugs that meet the health needs of most of the population, ensuring affordability, accessibility, and rational use. So that's what essential drug is all about. So any drug that meets the health needs of most of the population is included in the what essential drug list. And at the same time, they are made to be what affordable, accessible, and also promote rational drug use. So any drug that is relatively expensive and that are not cost effective, those drugs are not included in the what essential drug list, because this is the savior of the poor of the poorest in the society, essential drug list. So the same way now, if you come down to Nigeria essential drug list, broke easily from that World Health Organization essential drug list, so that drug can be accessible irrespective of their economic status. At least at the grassroots level, they can afford medical what drug what therapy that will not tear their what pockets. That will not tear their what pockets. Okay, so now let's continue. So what are the benefits of this essential drug list? Essential drug concept. Benefits is that it promotes the use of generics. Yes, because in essential drug list, they are nothing like brand. Brand is not brand. They don't, it's not based on brand. It's based on the generics. The generic name is used so that the best, the cost-effective one will be chosen. Remember what I told you guys about cost effectiveness. If drug A and drug B can treat the same disease or ailment, drug A and drug B can effectively treat the same health condition. But drug A is 3,000 naira and drug B is 500 naira. And through beyond reasonable doubts, both of them can treat that same disease condition perfectly. But A is 3,000 or 2,000, B is 500. The one that is 500 is more cost effective and one that is what? 3,000. That's what we mean by what? Cost effectiveness. So cost effectiveness is not only based on just the cost alone. You measure the cost and you compare the cost and effectiveness. How effective even it is, even if in that cost. The same way now, if you have two drugs, drug A and drug B, and drug A is 3,000, drug B is 500, and two of them, but drug A that is 3,000 can treat a particular health condition, and drug B that is 500 cannot treat it. Drug A that is 3,000 is cost effective, is more cost effective than the one that is cheap. That's why some people, they will go to where they will mix the drug. Instead of going to hospital, someone that is not feeling fine, or that has malaria, it's clear that this person has malaria. Instead of going to pharmacy to see a pharmacist and get straight anti-malaria that may be around 1,500 or 2,000, between the range of 1,500 and 2,000, and treat himself. He'll be going to a roadside drug peddler and be getting dose by dose. One dose, 500. After taking the dose, the malaria will come back again. You go back again and take another dose. Before you know what's going on, you spend like 3,000 taking small doses. Then at the end, nothing will happen. He will now, the malaria will not become seriously clinically manifested. That the person may even start vomiting and they lose appetite and they be rushed to the hospital, where they will now admit the person, and the person will now, by the time the person will finish every drip and the inpatient care, everything will now be getting towards 50,000 naira to treat malaria that has become a severe. This is what the person could have used 2,000 naira to buy anti-malaria, lumefantrine straight and treat it. Have you not seen it now? That one that is appear to be more expensive is now more cost effective than buying 200 naira doses and 500 naira doses. Forgetting that malaria is caused by plasmodium and there is tendency for relapse if you don't treat it head on. So this is what we mean by what? Cost effectiveness. So essential drug concept also ensured that drug is available, is readily available. It improves drug availability. At the same time, it also improves quality and what? Safety. So I wouldn't go deep into this much. Let me go straight to drug classification based on this list. So basically, actually, if you go into that essential drug concept, you find out that drugs are categorized by their level of care, from the village health post, things like aspirin, antacid, you see them, then to specialist hospitals, where you see things like anti-cancer drugs and the psychotropic drugs. Now let's go down to classification. So the first class I want us to look at. Let me see if there are people that need to be admitted, because what I want to say now is very important. Okay, 5 people need to be admitted. Okay. So the first one I want us to look at is anesthetics. Anesthetics. So these anesthetics are just there. They are used to do what? To prevent pain during surgical procedures. To prevent pain, they cause loss of consciousness. They cause loss of consciousness. It can be central. It can be local, depending. Maybe if they want to carry out a particular procedure in your hand, they don't need to give you the one that will act on their central nervous system that will become totally unconscious. They focus on the one, they will focus on the sites so that they will numb this area so you don't feel pain while they carry out the procedure in that particular location. But there are a type of procedure they want to do, they may have to give central one where the person will totally lose consciousness and they take care of it. After the whole thing, the person will come back again. Things like examples of such drugs, we have drugs like halothane, ketamine, thiopentone, lidocaine. These things are under what? Are some drugs under anesthetics. Excuse me, let me admit somebody. These drugs are under anesthetics. Then we also have analgesics, antipyretics, or the NSAIDs. We have analgesic, antipyretic, anti-inflammatory drugs. NSAIDs are also one of them, one of these drugs. NSAID means non-steroidal anti-inflammatory drugs like diclofenac, ibuprofen, and what have you. So these drugs, they relieve pain. They relieve pain. Some of them reduce fever. You see things like aspirin, paracetamol, ibuprofen. Then we also have anti-allergic drugs. Anti-allergic drug. These ones are used to treat allergies. Allergies. You see things like antihistamines. Example, chlorpheniramine, loratadine. They are antihistamines, especially H1, not H2. H2 are used for what? Ulcer treatment. We'll still look at the H2 in the treatment of ulcer. But these ones are mainly H1s, antihistamines. We have corticosteroids, we have epinephrine, they are under what? Anti-allergic drug. And we have antidotes. Antidotes are drugs that are used to neutralize poisons in the body. Or they're also used to take care of drug overdose. Drug overdose. You see things like naloxone. Naloxone is used for treatment of morphine overdose. Another one is, another example is N-acetylcysteine. N-acetylcysteine is used for treatment of paracetamol overdose. We also have activated charcoal. Activated charcoal, when you take it inside your GIT, it mops off poisons in the stomach, in the system. So activated charcoal is used as anti-poison, antidote. And it's an example of antidotes. Then we have anticonvulsants. Anticonvulsants. Anticonvulsants, they are used to manage or control seizures, epilepsies. They are what we call anti-epileptics. Example are carbamazepine, phenytoin, phenobarbital, and many of them. So these are under anticonvulsants. We also have anti-infectives. By the name anti-infective, they are used to fight infections. The infections can be fungal infections. If it is fungal infections, they are called antifungals. Example of antifungal, there are many of them. We have fluconazole. There are many of them. We have fluconazole. We have clotrimazole. We have ketoconazole. There are many of them. Then, if the infection in question is a bacterial infection, you see things like antibacterial antibiotics. You see things like gentamicin, ciprofloxacin. There are many of them. Then, if it is viral infection, they are called antiviral. Some of the antiviral are antiretroviral in nature, the one for HIV. We have acyclovir, there are many of them. We have lamivudine, zidovudine, there are many of them. Even anti-malaria can also be classified as anti-infectives because they are fighting plasmodium infection. Good. Then we also have under class anti-migraine agents. Anti-migraine agents. These ones are used, migraine is severe headache. Migraine is severe headache. So they used to treat severe headaches. Still things like ibuprofen, even ibuprofen to some extent is there. Then we also have anti-neoplastic drugs or immunosuppressive drugs. These ones are used in cancer treatments. They're used in cancer treatment. You have things like cyclophosphamide, vincristine, there are many of them. And we have another group, another class. This one treats neurological disorders. So drugs for neurological disorders. We start saying things like levodopa, we have bromocriptine, and what have you. Then we also have antiseptics and disinfectants. Antiseptics and disinfectants. Please, anyway, we'll still discuss antiseptics and disinfectants as a topic. They are under the topic germicides. They are under the topic germicides. They are under the topic germicides. We treat them as topics. So, but generally, they kill microorganisms. They kill bacteria on the surfaces. Some of them act on the surfaces. Some of them apply on the surface alone. Things like disinfectant. Some can be applied on the body system. Things like antiseptics. You start seeing your hydrogen peroxide, methyl spirit, and many of them. Methylated spirit and many of them. When we go into germicide, I'm going to pick them one after the other, and there are different classes. Then we have drugs that affect the blood. Hematinics. We have your ferrous sulfates. Ferrous sulfates is this. Cyanocobalamin is also there. And we have cardiovascular system drugs. Cardiovascular system. So basically, under cardiovascular system, start saying things like antihypertensive, cholesterolemia drugs, and what have you. In your final year, you will discuss this in your and final year. Now, here we take things like methidopa, lisinopril, and enalapril, nifedipine. There are subclasses of these classes. So please, I think we discussed it in the beginning of this course. And we also have drugs that are used in dental cases, dental drugs. You see things like for pain, benzocaine. You see things like antibacterial mouthwashes and what have you. Then we have drugs that we have dermatological drugs that are used for skin diseases. Most of them are also anti-infective. Some of them are anti-allergy. You see things like betamethasone incorporated in the body cream, in creams like from Bat A, Skinner contain ketoconazole and the other antibacterial at the same time corticosteroid. The same thing with Format A. Most of them are triple action. Some are quadruple action anyway. So now, whenever if you pick up brand like Format A or Skinner, I'm using their name because most of them are in combination. So I can't be calling every. That's why I'm using their name. Please remember that we don't work with name, with brand name. But I just mentioned it so that the one you're familiar with. So what you do is now, when you go home, if you get Skinner, look at the scanner, you see the component. Look at Format A, you see component. Most of them will have antibacterial one, anti-allergy, mainly corticosteroids, and the antifungal, depending on what they want that is them to treat. So that's why they are called triple action. So as a general name. Okay, so we have drugs that are used for the diagnostic drugs. So this one I use for diagnosis testing. You see things like barium sulfate, even your HIV test kits, HIV test kits, even your even pregnancy test kits, pregnancy test strip. They have human chorionic, human human chorionic hormones there that are used to, with this now, this if it is present in the particular urine, it will indicate that it's present there. So there are a lot of them you can use for the diagnosis. Then we have, in general, we have diuretics. Still under antihypertensive, you see things like this one's increase urine output anyway, so as to bring down blood pressure. You see things like furosemide, spironolactone. Under these diuretics, we have different subclasses under them. Some are loop diuretics, some are potassium sparing. There are a lot of them. So we have ENT drugs, ear, nose, and throat drugs for the ear, nose, and throat infections. We have your gentamicin drops. You have your chloramphenicol, both drops and ointments. There are many of them. Then we have your gastrointestinal drugs used to treat the disease of the gastrointestinal system. Here we have your antacids. We have your you are um um your proton pump inhibitors like your omeprazole, pantoprazole, all those prazoles. Remember our stem. Then we have antacid. There we have your mismag, compound magnesium trisilicate in tablet form, in suspension form. There are many of them. Then we also have your activated charcoal is also there for poisoning, to mop up the poisoning in the GIT and what have you. I think I mentioned it. This activated charcoal under under um under antidotes, anti-poison. Let me admit some people, please. Okay. So then we have your hormones. Hormones are also there, things like estrogen, progesterone, and what have you. Then we have the drugs on under class immunologicals. Immunologicals, those ones are there to boost immune system, things like vaccines for hepatitis, polio, measles, and many of them. Then we have your ophthalmic drugs. Ophthalmic drugs. If you have your ophthalmic drugs, this one is for eyes issues, things like timolol, brafenicol, drops, eye drops specifically, because of course timolol is not for infection anyway, but brafenicol is for eye infection. Good. Then we have the tocolytics or oxytocics. This one, example, we take things like oxytocin that is used to induce labor. We have the nifedipine can also be used as a tocolytic, where it prevents preterm labor. Preterm labor. Then we have some solutions using dialysis. Yeah, dialysis solution, maybe specifically in renal failure dialysis. Then we have electrolyte balance preparations, water and electrolyte balance preparations, water and electrolyte balance preparations. Here we see your oral rehydration salts. Then we have potassium chloride, most of this infusion, Rengas lactate, and what have you. They are under this water electrolyte balance preparations. And we have your psychotherapeutic drugs. Psychotherapeutic drugs, these ones are just there for psychosis. You see things like your chlorpromazine, even your diazepam as an anxiolytic can also be used. Yes. We have your respiratory system drugs. This one used to do respiratory, ranging from asthma treatment, cough, and what have you. See your bromazine, dosapram, even your your beta agonists and what have you. There are many of them. So all those ones are under respiratory drugs. You have your vitamins and minerals. Here you see your iron. Remember we mentioned under iron under hematinics, vitamins and minerals, iron, zinc is also there, multivitamins, all those ones are under vitamins and minerals. Of course, you know your astipa, astimine. Please know the difference between astipa and astimine. Astipa has iron present, but astimine there's no iron. Astimine is more of multivitamins, amino acids present. But astipa has a touch of iron. So that means when you are looking, when you are short of blood, astipa is more is preferred. But when you just want to boost your immune system, replenish one of tissues because of the arrays of amino acid present in histamine. Sorry, I'm using brand name because most of these syrup they contain a lot of ingredients, so I can't be mentioning all the ingredients. So that's why I'm using the brand name, at least the popular one in the market, the Nigerian market. Now we have under anti-infective. I made mention of antiretroviral drugs. Remember, so antiretroviral drugs. I also mentioned them things like lamivudine, citalopram, nevirapine. Okay, all right. So this is a rundown of classification of drugs. Any question? Any question? This class is not going to be a long one. So, any question? Okay. All right, let's continue. Let's continue. Now, let's briefly look at the drugs used in treatment of in alimentary system, gastrointestinal system diseases. So I'll just mention the disease, I just mention some drugs based on the curriculum. I'm not going deep into pharmacology, into pathophysiology, deep into that because of the level of we are operating. I'll just mention one or two things, say one or two things about the disease, then also mention the drugs and their classes of drugs used in the treatment. All right, so now let's look at the first thing I want to look at is what vomiting, emesis, vomiting, emesis. What is vomiting? Vomiting is a condition characterized by expulsion of stomach content through the mouth. You usually see nausea and vomiting. Nausea is the tendency, the symptom, the feeling to vomit. While vomit is the actual expulsion. So sometimes you may not see it without even vomiting. It happens once in a while. But most of the time you don't see it, most of the time you end up vomiting. So another name for vomiting is emesis. As I said, is expulsion of stomach content through the mouth. It is actually controlled by the vomiting center in the medulla. It's controlled by the vomiting center in the medulla. And it's triggered, triggered by a zone we call the chemoreceptor trigger zone, CTZ, chemoreceptor trigger zone. It can also be triggered by gut irritation. So if the chemoreceptor trigger zone is activated, it can lead to cascade of event that will lead to what? Vomiting. So this is basically what happens. Now, some drugs under this antiemetic, you see anticholinergics, anticholinergic drugs. You see things like dopamine antagonists like metoclopramide, the one you call placebo. We have your domperidone is also under this. We have cannabinoids, example, nabilone. Then we have the one that is popular, antihistamines. We have promethazine. It's popular. It's popular. The one you call what is it? The popular brand name in the markets. If I remember it, I'll tell you. So we
Lexotan.
have on that. Huh? Say it. Hello?
Lexotan.
No, no, it's not Lesotan. Lesotan is Lesotan is far, far from what we are talking about. It's not Lesotan. Lesotan is bromazepam under antidepressants. Benzodiazepine. That one is a threat not to get. Who knows the popular brand name for? God bless you, have a mind. God bless. Yes, have a mind. God bless you. Have a mind. So we have different types of vomiting. Please, vomiting differ. They are vomiting as a result of motion sickness. There are people that once they enter, once they're in a vehicle, once they are on motion, in motion, they will vomit. So that one day. So we have different types of vomiting. We have motion sickness vomiting, the one that is called by motion sickness. We have the one caused by drug-induced vomiting. We have post-anesthetic vomiting. We have post-anesthetic vomiting, and we have pregnancy-related vomiting. So each of them requires specific antiemetics. I think I have mentioned another name for drugs. I think I've said that antiemetics. So other examples, I've mentioned promethazine. Another example, you also have meclizine. Meclizine is also an antiemetic. Meclizine is also an antiemetic. Okay. Now, I wouldn't want to go deep into pharmacology. This is AUM, not pharmacology. So I don't, let me focus on treatment and take it up from there. Now, let's look at another issue with regards to intestinal condition. Constipation is another condition. So what is constipation? Constipation is a condition that is characterized by infrequent. Please mute your mind, please. Constipation is a condition that's characterized by infrequent or difficult bowel movement. Please, who is this? Silence your mic. Please mute your mic, please. Who is this? Mute your mic. I'll mute it myself. All right, let's continue. I said that constipation is a condition characterized by infrequent or difficult bowel movements, basically. Because I hope you know that when there is the peristaltic movement from as you eat your food, the food goes down the GIT, get digested, nutrients absorbed, the chaff go down and chime to the small intestine. For small intestine, once it moves, absorption will start taking place. They form solid. They become solid in the large intestine. Is that clear? Now, at this point in the large intestine, they may become too dry that in fact that there's no moisture at all. Coupled with issue with peristaltic movement, it can lead to constipation, not being able to do what? Pass out your what? Feces, not being able to carry out ingestion. Then you start forcing yourself to poop. Before you know what's going on, you may start having pie or hemorrhoid if care is not taken. So some of you, let me even make it more practical. Some of you eat junks. After eating junks, you don't have enough ball in your large intestine to help to facilitate these movements. You start having constipation. So if you don't even take water, some don't take fruits that have fibers, roughages that will help to facilitate these movements. So this is point of note. Please be careful about what you eat. Very important. Now, let's go to the management. Let me accept this person. So let's go to the management. Now, this constipation can be managed using purgatives or laxatives. Purgatives or laxatives. Purgative are one that can make it to purge. Laxative, as case may be. So basically, these are classified under, we have the one we call bulk forming agents. ball forming agent. They have, you remember what I said, that if you take enough roughages of fibers or food that have fiber, it will increase the ball in the large intestine, so that you'll be able to do what? Facilitate this movement. So bulk forming agents, things like bran, methyl cellulose, can help to form ball. We have fecal softeners. The one that soften the what? The feces, and at the same time, lubricates the what? The bowel. Things like liquid paraffin, We have stimulants, the one that will stimulate the movement, things like bisacodil or senna. Bisacodil is there as tablet, it's also there as suppository. Remember when we treated suppository in your first year, we talked about this bisacodil. Popular brand name is Ducolax. You can have it as tablet, you can also have it as what? Suppository. Then we have osmotic agent. Osmotic agent tends to draw water back into the large intestine so that there will be more fluid. If feces will not be too dry, so it can come out peacefully. Example is lactulose. So treatment of this constipation involves increasing dietary fiber. I think I talked about it. In fact, basically, increasing dietary fibers and fluids, very, very important. So make sure you take enough water, make sure you eat food that is laden with fiber, fruits, vegetables. If you want to eat food. Stop eating junks. Stop eating noodles. Stop eating processed foods. Stop all those junks. You say you are eating snacks. That's what you take for meal. It is taking carbonated drinks up and down. Drink water. Take fruits, oranges with fiber. Eat that if you take orange, that fiber, that roughage, that thing inside, you don't throw it away. Some people will just take the juice and throw the fiber away. No, take that fiber. It's very important. Chew it and swallow it. Some say that they are not goats. Yes, become the goats. But let fiber be in your system. It's very important. Eat your gare, eat your eba, eat your fufu. Not semo. Not semo. Semo has no fiber. Semo is processed. Am I communicating? So treatment involves increasing dietary fibers and fluids. Then, please, if the purgation is harsh, it can also lead to something else. So, especially in pregnancy, it can even cause abortion. So be careful. It should be avoided in that situation. Now, that's all I can say on constipation. Now, let me go straight to, let me see, since somebody wants to join us. Okay, some people. Okay. Now, let me look at the peptic ulcer disease. Peptic ulcer. To be sincere with you, here now that peptic ulcer is caused by H. pylori. H. pylori infection. H. pylori infection. H. pylori is a bacteria that colonize the, excuse me, what's going on? It's a bacteria that colonize the what? The GIT, specifically the stomach. In fact, this H. pylori, it focuses on the what? The lining of the GI. It deals with the lining of the GI. When the lining, protective layer of the GI is eroded, acid presence can cause perforation. So H. pylori is the culprit, is the chief culprit. Yes, prolonged use of NSAID can cause it, but the chief culprit is H. pylori. H. pylori can be transmitted through kissing. So be careful who you kiss, who you exchange saliva with. Saliva can transmit it. Body fluid. But it enters fast through saliva. So be careful who you kiss if you must kiss. So now, what is ulcer? Ulcer is just the sore in the stomach. Gastric, it can be gastric, it can be duodenal lining. So when there is sore, then ulcer has come. And if not taken care of, it will even lead to cancer of the stomach, from gastritis to cancer of the stomach and cancer of the intestine. So these things are very important we know this. So what are the symptoms? You see pain. The pain can be localized, the pain can be transferred. See the pain back, your waist. So vomiting, it can cause vomiting. The symptoms, vomiting is there, loss of appetite. You get filled, even if you are still hungry, but you are filled. You feel pain, but you are filled. Heartburn is also one of the symptoms. So what is the treatment of this? Basically, we have different classes. We have antacids. For us, antacid is there to neutralize the acidic content of the stomach. You see things like magnesium trisilicate, aluminum hydroxide based preparations. We have your H2 receptor blocker. Remember, I said something about antihistamine, H2 antihistamine. Remember when I was discussing antihistamine? We have things like cimetidine, ranitidine. These ones are H2 blockers. They prevent acid what? Preparation, acid formation. So we have, but the matter of them all in acid regulation is proton pump inhibitors, PPIs. You see things like they inhibit the proton pump through which channel through which proton hydrogen ion is pumped. You know that hydrogen ion is very, very important in acid. In fact, one the definition of acid, hydrogen ion, any definition of acid without hydrogen ion is not acid definition. So hydrogen ion is very important in acid formation. So no matter the type of acid it is. So omeprazole is an example of big proton pump inhibitors, pantoprazole. Please try to get your index. Try to get your index. I learned that the HOD is selling it or something. I don't know. If it is compulsory that you get it from him, you can get it from him. But if you are interested, I can make arrangements from MDEX office. If you're interested, you chat me up. At least I need like 10 people. I have a link to the MDEX office where they can send directly to you, but they cannot send out more than 10 copies, less than 10 copies at a time. So if you're interested, if I have 10 people, I can send message to the office. It will be sent directly to the school, depending. So if you're interested, let me know. That is, if the one in school is not this. But if the one in school is compulsory, please focus on the one in school. But if it's not compulsory and you're interested, let me know. DM me. All right, so let's continue. It's good. It's important to have your MDEX because it will help you because from now onwards, now you'll be treating different drug classes. If you are final year, so if you treat any particular drug class, you go to the MDEX. Apart from your textbooks and your course material, please. I don't know. I sent you a link, my Telegram link, where you can have access to pharmacology textbook. Did I send you such link? Pharmacology link, Telegram link. If I have not sent you, I will send you pharmacology link, my Telegram link. There's one textbook on pharmacology for pharmacy technician. I want you to have access. Please, I'll send you the link. If you join my pharmacology textbook Telegram group, you go to that. You see that textbook is there. Pharmacology textbook. You know, I got the soft copy from different sources and compile them there so that you can have access to them. Course material is not enough. Course material is handout is not enough. You need to be grounded. So our advice you after this topic, after going through this recorded lecture, going through this course material, then go to that channel, get that textbook, Pharmacology for Pharmacy Technician. Go there, study, these topics, you will be proud you did, and you'll be happy you did. Take it seriously. So you will be grounded in what pharmacology is. It's very important. Are we together? Are we together? Are
Yes,
we
sir.
together? Good, good. So we also have anti there are antibiotics used in ulcer treatment. You see things like amoxicillin, amoxicillin plus clarithromycin or metronidazole. These ones, please mute your mic. It's something my ear. Mute your mic, please. These ones are used in combination. The antibiotics, antibiotic. Who is this person? Mute your mic. Oh, you don't mute your mic. I'm looking for you. You're not good. All right, so let's continue. So now antibiotic enters because of the other ones I've been mentioning, just control the acid. Acid is one of the aggressive factors. In any ulcer situation, there is two factors involved: aggressive factor and the protective factor. They fight each other. Protective factors are your mucosal lining of the gastrointestinal tract, your prostaglandins, so some of the prostaglandins, then your aggressive factors, H. pylori is there, acid is there, so they fight each other. So the antibiotic come in because of the aggressive factor, which is H. pylori. But all these proton pump inhibitors, H2 receptor blockers, antacid, those ones are there to fight the the aggressive factor HCl. Now, so the antibiotics is just there for the because of H. pylori. So in H. pylori eradication, we have combination that contains proton pump inhibitors, and antibiotics. Proton pump inhibitors and antibiotics. You have the proton pump inhibitors can be depending on omeprazole, pantoprazole, rabeprazole, depend on different brands. Then we have amoxicillin plus clarithromycin or metronidazole. So you can have something like ulcer kit is an example of ulcer kit is an example of regimen used in the kit used in the eradication of H. pylori. You see things like omeprazole, you see things like clarithromycin, metronidazole. Some have omeprazole, amoxicillin, clarithromycin, or omeprazole, clarithromycin, and amoxicillin, metronidazole. So depending on how the particular brand package their own. So after this class, I want you to go and make research on some brands used for treatment of eradication of H. pylori. Then you see different combinations in each of them. Then we have another class of agents in treatment of ulcer. We have protective agents. Those one protect the mucosa. Things like socralfate, and bismuth compound. Hey, who is it person? And bismuth compound. Suliat, what is your issues? Suliat. Eh? Why do you always unmute your mic? I don't understand. All right, let's continue. So let's look at diarrhea. What is diarrhea? Diarrhea is opposite of what? Constipation. Opposite of what? Constipation. So diarrhea is just as against constipation, which is infrequent movements. Diarrhea is a condition that involves frequent watery stool. Frequent watery stools. Most times it occurs as a result of infection, most of the time. Now, You know, as I said, that the what is it called? The food, if you eat food, digest, the food you like digested, nutrients absorbed, then the chine, the water from enter the small intestine, from there as it get to the the, the large intestine, you start seeing absorption of the moisture of the water present there will start will take place. That's why what entered there as a watery form will now come out from your anus as solid, or at least semi-solid, because the water there has been absorbed. Now, sometimes due to infection and other issues, there can be problem with absorption of those moistures. The absorption of those moistures, the water in the large intestine from the fecal contents. And when there is problem with absorption, then that means what will come out from your feces will be what? Water. As feces will be what? Water. And there is always random spasmodic movement of the muscles of the large intestine that knows time to settle. So this frequent movement, bowel movement, can lead to what? Is what causes what? This what? Diarrhea, coupled with the fact that the water did not what? Absorb. That's why sometimes you cannot control. You may just be wasting time. Boom! It will come out on its own because the spasm going on there, the bowel movement is erratic. Remember, in constipation, there is infrequent, but in diarrhea, there is frequent bowel movements. The motility is on the high side. Let me admit this person, these people. Motility, gastric motility is excessive. You know that where that's this that gastric motility is what? Excessive. Now, so I said that it involves infrequent watery stools, often lead to what? Infection. So how can you treat it? Apart from slowing down this gastric motility, it's very important you do fluid replacement using ORS, because the water that is you are losing is a problem. The person may become dehydrated, even lose electrolytes. So there will be electrolyte imbalance. So there's need for using oral rehydration what? Solutions, so as to do what? Rehydrate the person. You person should also take enough fluids. Take enough fluids. So, and you're not serious at all. I catch you there. Now, now, so apart from the ORS that is there to rehydrate, we also you can also we use adsorbent, not adsorbents. Sometimes food poisoning can cause it, infection. So activated charcoal or kaolin can be used to mop those content of gel that causing this what issue. Then anti-motility agent. Remember, the target is to slow down motility. In constipation, you want to increase motility. So bowel movement can occur so that the feces will go out. But in diarrhea, there is high motility. So you want to increase the what? The motility. That's why we are using anti-motility. Something like loperamide. That's why we use loperamide. Loperamide, because it's an anti-motility agent. Then spasms of the muscles can also cause it. So you use antispasmodics can also be used. Something like mebeverine can be used. There are many of them. So these, then also, of course, now, if you identify as a particular, if it's food poisoning from bacteria, you can use antibacterial depending anyway. if need be. So this is exactly what happens in what treatment of diarrhea and treatment of what diarrhea. So this is where we end lecture, our today's lecture on AUM. If you have any question, you ask. If you don't have any question, don't go. We'll come back for the BDP, or the BDP, Basic Dispensing Protocol. If you have any question to ask, any question? So when you have access to that textbook, I've laid foundation. Read, go read ahead, read deep into the topic. There are a lot of them, but for the purpose of this class, I limit myself to what the scope we are learning. But I want you to go deep, go deeper, so that you'll be grounded, more grounded than this. If there's any, in the absence of any question, we'll end this lecture here. As I say, don't go. I'm coming back for your
Yes, sir.
basic. For your coming back for your basic dispensing
Question,
practice.
sir.
I ask.
Okay.
Ask.
Under constipation, can you hear me, sir?
I can hear you.
Under constipation, you said there's a drugs you talk about. You said lactose. I don't know, maybe I get it right. After stimulating misacodine, the next one you said lactose. I want to ask, like according to what you said is used to. I could not get that point very well. Well, I'm just asking that this lactose, this is my first time of hearing it, and is there a side effect for it?
See, I don't even know what you are talking about. See what will happen. You get record of this, okay? What you are calling, I'm not familiar with what you are calling. I don't know when I mentioned it. Lactose. I didn't mention lactose. See what will happen. Can you hear me?
I can hear you,
Can you
sir.
hear me? Yes. See what will happen.
I can hear you.
Yes, you can get this material, this recorded material. When you listen to it, then if you get accurately what you heard, then you let me know. I will now answer the question, okay? Did you get what I said?
Yes, sir.
Had it been you know what you are saying is clear, I would have answered it, but I don't know exactly, and I can't go back. It is so. What will happen is this: when you get this recorded, I will put the link. If you listen to it, if you get to that point, we have that thing you said I mentioned. Just chat me up or drop it in the group. I will explain. Are we together?
All right,
Maybe
sir.
self. Maybe self. By the time you listen to it, self, you may see no need again to ask question. That's why I'm recording the lecture, so you can play it over and over again and get the point you could not get. Maybe if there's something you want to jump down, you not get. You play it so you can get it. Are we together? All right. In the absence of that, we'll end this class now because I truly want. I don't want us to waste more time because I have final years by 11, so I need we need to do our PDP. Just listen to it and get back to me if there's still need for you to get back to me. Okay. All right. So we'll end here for now. Then come back for PDP. Thank you very much. God bless you.